Hello, my name is Macy Limberhand. I'm a student nurse and I will be demonstrating how to give a subcutaneous injection. So the first thing I'm going to do is I'm going to start by listing out my 6 rights of medication administration. And those are right patient, right medication, right route, right dose, right time, and right documentation. Next, I will perform some hand hygiene. And then I'm going to look at my MAR and my medication orders to see what I'll be giving. So my medication order says to give 5,000 units of heparin subcutaneous every 12 hours, so now. And I will be using an ampule. Okay. And the patient I'm going to be administering it to is Skip Rocker. Date of birth is 02/03 for 75. So I will go ahead and get my supplies. So here's my supplies. I'm going to put on some gloves. And when I'm doing this, normally I would be using a TB syringe, but our TB syringes, you can't replace the needles. So I will just be using a regular 1 ml syringe, and I am going to be using the correct needle size, which is a 22 gauge, I believe. Yes. So first I'm going to grab my ampule of heparin. And I'm just going to set it here. I will be looking if there's anything wrong with the ampule, if it's cracked, but nothing is wrong with it. I would look at the expiration date as well. And then I'm going to draw up, I'm going to get my syringe ready before. So here I have a filter needle, and I'm going to look at my MAR again and draw up 0.5 mils of air. There we go. I'm just going to attach my filter straw. Set that aside for a second. Now I have just a regular piece of gauze, and I'm going to crack open my vial, making sure everything's at the bottom, or my ampule. There we go. I guess you don't have to draw 5 mils or 0.5 mils of air because it's a vial, so, or an ampule. So just gonna let that go, and without touching the sides, I'm going to draw up 0.5 mils. This is not working super well, so I tip it upside down. Okay, I'm going to see how much I have here because I have a ton of bubbles. Okay. Now I have no bubbles. and I have to go grab a needle. Okay, so I am aware that I would use a 27 gauge, about 5/8 of an inch, for this injection. However, I don't have one of those needles for this specific syringe. So this is a 22 gauge. I think it's a 1.5 inch needle, but just to be aware, I do know that I would not use that. And since this needle is so long, I just won't put it into my patient folder. So once I have my medication ready, I am going to go to the patient's room. And before I would go in, I would confirm the 6 rights of medication administration again, make sure I have the right drug, the right route, the right dose, it's the right time. And then I would go into my patient's room and I would look at their wristband or have them confirm that this is Skip Rocker, birth date 2/3/75. And that is correct. So I'm going to get him prepped by cleansing the site. And since this is subcutaneous, I would give it in the abdomen. This time I will give it into the back of the arm because I did just give him his shot of insulin in the abdomen. So this is heparin, 5,000 units. And he is not an obese person again. So I will be giving this at a 45-degree angle. And like I said, I just will not go in as far and pretend like this is a 27 gauge needle. So we're going to go in at I'm going to hold with my non-dominant hand, and I'm going to go in at a 45-degree angle, dart in, and then give the full medication, and straight back out. And I'm going to recap. Actually, I wouldn't recap. I lied. I would put this directly into a sharps container. Now, I am going to just, pat him dry because it might have this little drainage. He's a tomato, so he doesn't take it very well. Okay, next thing I would do is I would go to my medication administration. And as you can see, I've already documented that that is my name. Administered heparin, 5,000 units, which would be 0.5 milliliters, the time, the date, and my initials.